Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode 284 of the Ask Dr. Angela podcast. So how was your day today? My day was crazy, so crazy. Most of my days are crazy, and I mean that in like the best way. And by crazy, I mean, I'm waking up at some ridiculous hour in the morning so that I can do my yoga. Yoga is something that I decided to add to my regimen this new year because I needed more core strength, flexibility. I needed to meditate more, and I really have found that it's quite grounding. I like the stretching first thing in the morning. It helps to sort of center me. And you guys know that I am actually in really good shape. I work out at least 4 times a week. I do cross training and a personal training session at least once a week. So a total of 4 times a week I'm working out. But I have always found yoga to be really cool. And so I decided at the prompting of a patient actually to give it a try. And I've got to tell you, I'm really loving it. I usually do it first thing in the morning, which is usually around 5 a.m. Because otherwise I'm not going to have time to do it, because after that, got to get the mini ready and then a long day at work. And usually my workout is in the evening right after work. So, if I wasn't going to do it first thing in the morning, i.e. the yoga, when am I going to get it done? But it's a really good practice that I'm enjoying. So did the yoga, had a really long day in the office today, but an enjoyable day in the office. I absolutely love seeing patients. It really drives what I do. It certainly, I wouldn't have this brand if it weren't for what I do for a living, which is take care of women all day, every day. And, I certainly... It's such an honor and a privilege to be able to do what I do, and I do not and will not ever take that for granted. So the topic of today's podcast really kind of came to me after a long day of seeing patients in the office. And so I'm calling this podcast, The Choice is Yours, How to Choose a Physician. And the reason that this came to me is I met several patients today that were actually interviewing me to be their physician. And, the short of it is people were coming to see me because, they read all of my reviews online and they were fantastic. But they were not happy with their previous provider for whatever reason, whether they were not satisfied with the care, they thought that they were mismanaged, or quite frankly, they just didn't feel a connection. And so, whenever I meet patients that are coming to me either to see if they think I'm a good fit for them or perhaps even for a second opinion, I always commend women for, number one, taking their own healthcare seriously and being in charge of their own healthcare, but most importantly, for realizing that you have a choice. You always have a choice. And, certainly if you are not happy with the care that you're receiving, or you just don't feel like it's a good connection, you need to move on. There are tons of physicians, OBGYNs out there, and certainly you're going to find someone that's a good fit for you, a good match for you. And so certainly I welcome patients to come in to interview me to be their physician. Certainly some of the things that I look for and I expect that patients look for are, number one, you want your physician to be board certified. That ensures a couple of things. Number one, that they're current in their specialty. They're adept at doing all the things that you're supposed to be able to do in your specialty, and that you're equipped both skill and knowledge-wise to take care of patients in your field of study. Number two, I always recommend that you read reviews. Read reviews on your physicians because most patients fill out these surveys, questionnaires, or, reviews, they're completely anonymous. And so I find that most people give you their honest opinions on what their experience has been, what they truly feel are strengths and weaknesses of the providers. Now, certainly, you're always going to have that one outlier that writes something completely insane that may or may not be true. But by and far, I do find that, a lot of the online reviews are pretty, accurate to a degree, a large degree, if I want to be completely honest with you. You want to find a physician that you trust, that you have a good feeling with. I always say, trust that inner voice. Trust that voice from the inside. Find a physician that is relatable, that's easy to communicate with, that explains things in a way that you can understand. Or how about just explains things? I see a lot of patients that leave practices just based on the fact that they have no idea what's going on with them. Things are being done to them and they're taking all sorts of medications and they have no idea why. One of the most important things that I always tell patients to look for in a physician is find someone who listens. I find that probably one of the most important things about being a doctor is the ability to listen and truly understand what it is that your patient is trying to convey. I tell people all the time, if you just listen, people will tell you, the patient will tell you exactly what is going on with them. You just have to be willing to receive it. If you happen to have a physician that is not willing to take the time to listen to you, to answer your questions, then they do not deserve to be your physician. And all of these things sound very easy, matter of fact, but you would be surprised. So just remember, I hope this podcast will help someone. Just please remember, you always have a choice. Demand to receive the care that you deserve. And certainly if you don't feel as if you're getting that care, and if you don't feel like this is something that you can openly communicate with your physician so that appropriate adjustments can be made, then perhaps you would be better served. Do yourself a favor and find someone that can certainly meet your needs. Thank you so much for tuning in to this episode. I do think it was pretty necessary and worthwhile, because I'm being interviewed a lot by patients that are looking for new physicians, and I'm excited to be taking on so many patients. People ask me all the time, will I ever stop accepting new patients? And the answer to that is no. I take care of some really amazing and dynamic patients, and I will never be too busy to see new patients. So thanks again for tuning in. I hope that these pointers are helpful to you. Certainly, if you have questions, issues, topics that you would like featured on the podcast, you know where to reach me. www.askdrangela.com. That's AskDrangela.com. All of my social media outlets are there. You can follow along. You can send me direct messages. You can send me a direct email. Thank you so much for your continued support. My pregnancy book is finally dropping on April 9th. That's a Tuesday. I keep repeating that because it's really going to happen this time. I've decided to get out of my own way and just release it into the universe. And I am confident that you all will be as entertained and educated as I was, not only in writing it, but in experiencing it. So in closing, I'm going to leave you with this. And again, this comes from one of my favorite books, my Congratulations Graduate book. And this is what it says, words of wisdom. Make new friends, but cherish the old ones. Don't use time or words carelessly. Neither can be retrieved. Judge your success by the degree that you are enjoying peace, health, and love. Smile a lot. It costs nothing, yet is beyond priceless. Thank you so much for tuning into this episode of the Ask Dr. Angela podcast. Until next time, look better, feel better, be better. Looking forward to reconnecting on episode 285.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.